I'm Matt Meisner, and I'm the Residency Program Director at Geisinger Medical Center in Danville. The majority of our rotations are done at Geisinger Medical Center in Danville, where we have a massive tertiary referral center and a very unique patient population. Because of the unique patient population, we treat a complex array of urologic conditions that make for a great residency experience. Our day-to-day resident service is very busy. The residents are broken up among rotations which include oncology, endourology, pediatric urology, and various others. The operative experience is quite robust. We have all fellowship trained faculty in oncology, endourology, and male reconstructive surgery. We also have a close collaboration with our urogynecology colleagues for female reconstructive cases. And the residents essentially spend 80% of their time in the operating room, 20% of their time in the clinic, depending on the rotation they're on. In addition to the day-to-day clinical load, we have a very comprehensive didactic program that includes formal didactics with Campbell's Club and Grand Rounds Journal Club. We also have a simulation curriculum that includes 2 cadaver labs a year, in addition to a fully resourced simulation center here at Geisinger. I've been at Geisinger for 6 years, going on into my 7th right now, and my favorite part about Geisinger is by far the people. So let's start with the patients. The patients we take care of have very little exposure to the healthcare system, and when you meet them, oftentimes you are the only doctor they've seen in maybe decades. And it's a challenge, but it's also very rewarding. You form lifelong bonds with those patients, and you get to see them through their entire disease course. And I think that's special about Geisinger, and it's because of our location and because of the people that we serve. The strongest part of our program is definitely the clinical volume, and that's just because of the patient population that I just mentioned. There is no shortage of urologic disease, especially in our demographic, and it makes for great training. The best part of our program is definitely the residents. The residents all kind of have the same mentality that you're here to work hard and learn and to take care of people. And I think that comes out. A lot of the applicants who've been to our program before have described our residents as like a family, and that's pretty much what it seems like. The other great thing about Geisinger is its small program size. This allows for a lot of one-to-one interaction between residents and faculty. It facilitates an easier kind of granting of autonomy in the clinic and the operating room because we get a lot of exposure to the residents. We know their capabilities, we know their strengths and weaknesses, and so it's easier for us to move them along from a learning standpoint. So Geisinger really hits all of the elements I think you need for a good, strong residency program. We've got wonderful, well-trained clinical faculty in almost every urologic subspecialty. Our residents have very strong relationships with each other and with the attendings and staff. We have a robust clinical research and educational infrastructure that facilitates resident growth.